Rudolf Pichlmayer. Rudolf Pichlmayer, 16 May 1932, in Munich, Germany, 29 August 1997, in Acapulco, Mexico, was a German surgeon and head of the Abdominal and Transplantation Surgery Department of the Hannover Medical School. He was one of the leading transplant physicians in Germany. He is considered a pioneer in liver transplantation. The introduction of the term transplantation medicine goes back to Pichlmayer. Life. Rudolf Pichlmayer grew up in Munich and studied medicine at the Ludwig Maximilian University from 1951. He then worked as an assistant doctor in pathology and pediatric surgery before joining Rudolf Zenker at the surgical clinic of the University of Munich in 1960. Pichlmayer's main focus in training at Zenker was the treatment of immunological problems that occur in the form of rejection reactions after transplantation of foreign tissue. His habilitation thesis was groundbreaking for the development of early immunosuppressive methods. For example, the first heart transplantation by Christian Barnard in 1967 used the antilymphocytic globulins developed by Pichlmayer. The head of the Institute of Surgical Research in Munich, Walter Brendel, at whose institute Pichlmayer was involved in the development of this antilymphocytic serum ALS, was also involved in the development of this antilymphocytic globulin. In 1968, he moved from Munich to Hanover to the Hannover Medical School MHH, where he worked in the Department of Thoracic Surgery under Hans-Georg Borst. Just 1 year later, he was head of the Department of Special Surgery and Transplantation. In 1973, Pichlmayer finally became full professor at the Department of Abdominal and Transplant Surgery. Under his leadership, numerous surgical techniques were developed here. In 1988, Pichlmayer performed the world's first so-called split liver transplantation, in which the donor liver was divided and implanted into 2 transplant recipients. During his time at the MHH, he was involved in 4,278 transplantations of liver, kidney, and pancreas. Together with his wife Ine, he founded the Foundation Rehabilitation After Organ Transplantation in Children and Adolescents, later Rudolf Pichlmayer Foundation, which is dedicated to the physical and psychological convalescence of children and adolescents after organ transplantation. In 1990, the foundation acquired a farm, which was subsequently converted into the Ederhof Rehabilitation Center. Pichlmayer has received numerous awards, including the Ernst Jung Prize in 1985, the Erich Schlexer Prize, the Lucy Bolt Prize in 1986, and the Lower Saxony Prize in 1987. His postdoctoral thesis on production and effects of heterologous anti-dog lymphocyte serum in 1968 received the von Langenbeck Award, the most prestigious recognition of the German Society for Surgery. He also won the Bruno Kreisky Prize for Services to Human Rights in 1993. In 1986, he was elected a member of the Leopoldina. He was also a member of the Central Ethics Commission at the German Medical Association. In 1990, Pichlmayer was elected Physician of the Year in Germany. Most recently, he was president of the German Society of Surgery. Rudolf Pichlmayer died during a stay in Mexico during the 37th World Congress of Surgery in Acapulco while swimming in the morning. On January 12, 2006, Alexis Carrel Street in Hanover was renamed Rudolf Pichlmayer Street. Publications selection. Production and effects of heterologous anti-dog lymphocyte serum in 1968. Treatment outcome of palliative Rhone/R2 resection of stomach carcinoma, Feb. 1996. Surgical activity for blunt injuries of the liver, Jan. 1987.